Hi, and welcome to Deborah Talks Teeth. I'm Deborah, I'm a dental hygienist. And let me just say, if you're watching this because you have an upcoming dental appointment and it makes you nervous, I can totally relate. And I know what that anxiety feeling feels like. Over 70% of the US population has some sort of dental anxiety. And all the scary movies, all the things we do make the dentist look really horrible. But it doesn't have to be that way. There are things that can be done to make the visit a little more comfortable. And I'll go into a video about that a little bit more. But let's talk about this anxiety. It probably stems from something, well, it stems from something that happened in the past, obviously. And it's unfortunate because it makes it very difficult when you come in. I can't tell you how many times patients have told me they lost sleep over coming. They're anxious over being embarrassed by coming in or nervous about what they're going to find out from the dentist or whatever it may be. So the loss of sleep, anxious when you drive in, anxious when you're sitting in the waiting room, it's real. And I think that your dental professionals need to be aware of it if they're not. And maybe explaining to your dental professional what's going on will help a little bit more and give us a little bit more understanding to be a little more compassionate to your situation. I usually can tell when someone is having some anxiety issue. We take blood pressure prior to when the appointment starts, and I find that those that are super anxious tend to have a higher blood pressure reading in the beginning. And when that happens, I usually will retake it midway or at the end of the appointment just to see if it has gone down. Excuse me, I have to take a drink. So yeah, we take the blood pressure and, maybe ask your hygienist, your dentist to just let you sit in the chair for a moment and get adjusted to everything going on in the office for a moment. And that's okay. Don't be afraid to ask. You might want your hygienist, your dentist to explain things more too, which is okay. Ask if that makes you feel better. Some things that I recommend for anxiety are anything that brings you comfort. If that's a blanket, headphones, um, whatever, noise cancellation, whatever it may be. In our office, we actually have a comfort menu. We are very patient-centered where I work, and I absolutely love that. But we offer things that help with that anxiety. We have those stress balls that you can squeeze. Um, we have eye covering, like the, oh gosh, what are those things? The things that you put on at nighttime. We have a weighted blanket, which probably weighs about 50 pounds. It's heavy. And then we have a whole slew of different things to just take that anxiety away. It had to have stemmed. Anxiety is not something that happened yesterday. It's something that happened way before. And whatever it may have been for you, I can totally understand and relate to you guys. I too have dental anxiety, and I'm in the business. I don't know if it's because of I hate needles. I hate needles. So I don't know if that's what it is. But if I could give you one piece of advice, don't be afraid to ask or let us know what's going on because we can help you. I know for me, when I have to get an injection or something in my mouth, that I will let the doctor know that, hey, I'm anxious about this. And they just do different things to help you out with that. And I love that. So I think the thing to get out of this conversation is you matter. Your anxiety has to be addressed. It's okay that you have it. Maybe sitting in the chair a little bit longer, laying back a little slower, whatever we need to do to help you out and support that anxiety, that fear should be the top of the line here, because that is everything. So I just want to let you know that I feel your pain, I feel it, and I hope that you can come to this channel if you ever have any issues and we could talk about it. I would love to hear about what concerns you so that we can address it and learn to deal with it a little differently, because dental health is super important, and I really wouldn't want your anxiety stopping you from accessing it, because you know no one wants pain in their mouth if they don't have to. And anxiety is a big deal. The other thing I wanted to talk about too, if it's really bad, ask your office if they offer anything for you to physically take, like a pill, medication, prior to your dental visit. Or we also offer like nitrous or something of that sort, just to, laughing gas, if you don't know, make the appointment a little easier. We could do that too. Well, I don't want to say we, but dental offices can do that. They can recommend that for you most of the time. But with that, you would just need someone to take you to the visit if you're taking medication. So yeah, I hope that helped, and I welcome you back to come back for upcoming videos. Leave your comments, leave your concerns, let me know what's going on. Let's have a conversation. And I hope your visit goes well. Bye for now.